Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all to HeartWise Talks brought to you by Voice of Healthcare in honor of World Heart Day 2024. As we present our special series Heart 2024 Act Now for a Healthier Tomorrow. This series is dedicated to empowering you with a vital knowledge about heart health. Our theme, Use Heart for Action, reflects our commitment to promoting heart disease prevention, encouraging regular health checkups, and advocating for cardiovascular health priorities. And for today's episode, we have with us Dr. Amit Malik, Senior Director and Coordinator of Interventional Cardiology Electrophysiology at Max Hospital, Dwarka. Dr. Malik brings a wealth of expertise in cardiac sciences with a focus on cardiac electrophysiology, pacemakers, and complex coronary interventions. His distinguished careers spans roles at renowned institutions including BLK Super Specialty Hospital, Indraprastha Apollo Hospital, and National Heart Center in Singapore. With advanced fellowship and numerous research publications, Dr. Malik is a leading voice in arrhythmia management, heart failure, and cutting edge cardiac procedures. Welcome to our show, Dr. Malik. It's an honor to have you with us.
Thank you, Ms. Chaudhary. I am based at Max Hospital, Vaishali, Ghaziabad, basically.
Oh, I'm sorry for that. So
Yeah.
that's just little correction. Thank you for that correction. Uh, Dr. Malik, we'll be focusing on today's episode about heart failure reasons, treatment options, and life with heart failure. So, starting with understanding about heart failure. So, heart failure is the term that can sound alarming. So, could you explain what exactly heart failure is and how it differs from heart attack?
So heart failure is basically a condition when your heart pumping capacity goes down. So your heart muscles are weak and heart is not able to pump enough blood to meet the metabolic demand of other organs of the body. So this is the common cause of a common presentation of heart failure. Nowadays, there is another term, heart failure, when we use a preserved ejection fraction heart failure, when there is no reduction in the heart pumping, heart muscles become so stiff that they fail to relax during the filling of the heart. So this is another new category, but the majority of the patients they have got a reduced heart pumping capacity because of the damage in the heart muscle, and this lead to the heart failure syndrome.
Thank you, doctor, for explaining that difference to us and to all our audience. Moving on to the common causes of heart failure, since you just explained us the difference between heart attack and heart failure, so we would like to know what are the common causes of heart failure, and are there specific risk factors that people should be aware of, or specific age group they should be aware and be preventive about their heart health.
So if you compare from the Western population, the onset of heart failure is little bit early in Indian population.
Hmm.
And if you ask me, so almost about 1% of the population at the given point of time is suffering from heart failure in a various stages. If we talk about the causes, as I told you, that the most important one is the damage to the heart muscle. So damage to the heart muscle, most important cause in India is the ischemic heart disease or coronary heart disease, जिसको कि आप heart attack के नाम से जानते हैं. So whenever there is a heart attack, because of the lack of the blood supply, so there is a damage to the heart muscle.
Hmm.
Over a period of time, this damaged heart muscle leads to the weak pumping of the heart and leading to ultimately heart failure. The other causes are because of the valve dysfunction. If you have valve abnormalities over a period of time, that will lead to the weakening of the heart muscle and ultimately heart failure. Sometimes there is swelling over the heart muscles after certain infections, like viral infections, even in certain pregnancies. There is an inflammation of the heart muscle, which we call a peripartum cardiomyopathy, and it will ultimately lead to the poor pumping of the heart. One important cause nowadays is the chemotherapies used for the cancer treatment. So certain drugs in the chemotherapy, they affect the heart muscle adversely. So we always guide them to monitor the heart pumping after every chemotherapy so that you can pick up that adverse effect timely. So these are the basically common causes of heart failure in our population.
Thank you, sir, for explaining that common causes because it is very important. People should understand the reasons, the factors, or this thing. Why is this happening, and they should be aware. The precautions should be taken at an early stage, so we do not see further such cases. So, since we talked about causes, so heart failure can develop slowly or quickly. So, what are the typical signs and symptoms that someone might experience while heart failure uh, time?
Yeah. So, as you rightly said, that it developed gradually and gradually. So, you
Hmm.
can ignore the early warning signs initially. And as I told you, the most common presentation is the poor pumping of the heart, leading to inadequate blood supply to the other organ. So, the
Hmm.
most important initial presentation will be that lack of energy during the effort, or a patient may feel out of breath when he or she exert. So these are the initial presentation. Over a period of time, these symptoms become advanced and patient become out of breath even during routine activity or even during rest. So whenever lies down, he or she lies down, he feels out of breath and he has to sit up again and again. Sometimes these patients have chronic cough because of the lung congestion and they ignore initially that it might be due to the heart failure. In advanced case, there is a fluid congestion or fluid retention in the body, like abdominal swelling, swelling around the ankle joints over a period of time, reduced urine output in the advanced stage. When there is a poor pumping of the heart, so you may feel the abnormal heart beating or the palpitation or the skip beat. Sometimes patient may feel a dizziness or giddiness because of the abnormal heart. So these are the basically common presentation of a heart failure.
Doctor, like you just explained us about some of the signs and symptoms of heart failure, there is one very common symptom which is very difficult to understand by what is the reason behind this. So, at normally this humid weather or let's say hot weather or somewhere around these kind of weathers, sweating is quite normal. Whether it's young age, mid age, or the later ages, sweating is quite normal. But sometimes at later people are around 50 or 50 plus sweating, they might take that sweating in a wrong direction. Okay, this could be a sign of heart attack because it is one of the symptoms along with other symptoms. So how should people be aware about if sweating is happening with this kind of symptoms? Then yes, it you might need to take actions, but in what cases sweating is normal?
Okay, so every individual has got its own schedule, a
Hmm.
daily routine schedule. So if he or she was able to do that schedule comfortably, that's okay. But now, during those activity which he or she used to do previously, now if he or she is feeling breathlessness, unusual sweating, unusual discomfort in the chest, those are the alarming signs. That previously I was able to do the same activity without any symptom. All right. Now, suppose I used to walk from my car park to my office cabin, and this was my routine schedule. And I
Hmm.
used to do it for the years together without any symptom. But now I am getting some unusual sweating or unusual breathlessness in my this routine schedule activity. That is an early warning sign that you should get checked yourself.
I think you explained us a very important part because it is very difficult to understand. As I was talking to my father also, he said, ki, yeah, everything is fine and this is just the normal sweating. So I was okay, ki, theek hai. If that is the case, then you must go and visit to the doctor. Luckily, he went and everything, every test report and everything came all right. But then this point came in my mind, why shouldn't I ask you and let our audience be aware of this and they should monitor that this is one of the very crucial step or a point to measure around. So, since we talked about signs and symptoms, so diagnosis and in early detection is very crucial. So, how is heart failure diagnosed, and what test or evaluation are used to confirm this condition at
Very
medical?
good. Yeah. So as I told you that heart failure is basically a normality of the heart muscles. Either they are too weak to pump enough or they become so stiff so that they fail to relax. So we have to check basically the heart pumping status, and the most common and easily available investigation tool is the echocardiography. So echocardiography will give you an idea that what about your heart pumping, what is the status of your heart valves, and what is the status of the heart muscles at that particular period of time. So that is one of the easily available and the most important screening tool. Other tests, as per the condition required, so patient may need a advanced investigation like in the form of the coronary angiography. You have to check for any abnormal heartbeat in these patients. So you have to monitor for them for a long term Holter monitoring, that does he or she is having abnormal palpitation or abnormal heartbeat in his or her routine schedule. So you can pick up those things earlier. Certain cases, as I told you, that during chemotherapy, after pregnancy, or after certain viral infection, the heart muscle itself get inflamed. In those cases, we need a special cardiac MRI to detect those swelling in the heart muscle. So this is how you proceed step by step to diagnose a heart failure.
And let's say a patient comes to you with a complaint of heart failure or any kind of complaint, and doctors then diagnose that the person is suffering from heart failure. So, what are the treatment options available to that patient or to the person, and that can immediately be taken and the life can be saved?
Yeah. So heart failure has got basically it is categorized as per the stage. In which stage the patient is presented to you. All right, that is categorized from stage 1 to stage 4. Stage 1 is when a patient is getting symptom during exertion, and stage 4 is that even the patient is symptomatic even at rest or lying down. So that is how the entire spectrum covers. Now, whenever the patient presented to you, so you investigate and find out that what is the cause of heart failure in this patient. Does he or she have a previous heart attack, multiple heart attack leading to the weak heart muscles? Does he or she have a previous any infection leading to the inflammation of the heart muscles? Or does the patient is having any history of any receiving any chemotherapy for the cancer treatment, and all these things? So depending on the presentation and your diagnosis, you start treatment. Nowadays, we have got a very effective medical management. Nowadays, the drugs has got very advanced, and we have seen in last almost 1 decade that the treatment for the heart failure, if you pick up early and start these medications early, certain patients, even the heart pumping, if it was 20-25%, it recovers, but that
Hmm.
depends that what stage patient presented to. So one is the medical management, which is very important in that. Along with the medical management, now suppose this patient is having previous history of heart attack. So क्या उसकी coronary artery में blockage अभी भी है? That will be diagnosed by doing a coronary angiogram. And if there is any blockage, you try to open it either by angioplasty or by coronary bypass surgery. Because heart muscle need a proper blood supply. If there is no proper blood supply, they become weaker and weaker over a period of time.
Hmm.
Second thing, does the patient having any abnormality of in the heart valves? So if there is any abnormal, either they are blocked or there is a leakage. Valves are meant for a unidirectional flow. So does the heart valve is working properly or not? If there is any abnormality, do we need to correct it by surgery or not? So second thing is to check the heart valve. Third, does the patient is having a heart rhythm normally or there is any irregularity in that? So you have to correct the heartbeat abnormalities. Now, once you correct all these things, second, Does he or she having adequate control of blood pressure, cholesterol, diabetes? You have to quit smoking. You have to stop alcohol.
Hmm.
So these are the lifestyle modification and risk modification methods. Now, after this, certain patient need a mechanical support. Mechanical support, that heart pumping is weak, but it has to pump. You can't stop that to give the rest. So there are mechanical things in the form of advanced pacemaker. Those pacemaker are meant for heart failure. We call it then CRT therapy, cardiac resynchronization therapy. They are the advanced pacemaker. They have got a three wires so that they stimulate the heart in a synchronized way so that the pumping become more efficient. Number one, and number two, any heartbeat abnormality sudden, that can be taken care of by, because these advanced pacemaker has got a life saving mechanism that it can detect abnormal heartbeat and give shock within 10 seconds to revert it back so that you can abort a sudden cardiac arrest.
Hmm.
After that, next step is that the patient is still not means responding to the treatment and he is refractory to the treatment. So next thing is what we call the artificial pump. So there are nowadays artificial heart pump is available. We call it a LVAD, left ventricular assisted device. So that pump will take care of the pumping function of the normal heart, which is weak already, and that will act as a pump to circulate the blood into the other organs of the body. And the last resort come as a cardiac transplant.
Thank you so much, Dr. Malik. You explained all the process and the steps to us in a very simple language. And now it is very easy for us in the audience to understand the process behind this. Moving on, since we know that heart disease is becoming more and more common at an early age as well, so what preventive measures can individual take to reduce their risk of developing heart failures, particularly those with a family history or other risk factors?
So most important thing is that you should know your risk factor. That
Hmm.
what particular risk factor are you running with? All right. Nowadays, our young generation, because of the professional stress and demand, so there is a very hectic lifestyle, and that hectic lifestyle will lead to the all kind of lifestyle diseases. All right, you talk about early onset diabetes, obesity, lack of sleep, hypertension. So all these things you see is more prevalent nowadays in our society. Even nowadays, you see a lot of work culture of work from home. So your
Yes.
physical activity has gone down further. So in young age, most important risk factor in an inter-heart study was a mental stress. So, mental stress, lack of adequate sleep, lack of adequate nutrition, frequent use of junk food, smoking, excess alcohol. These are basically things which you can modify. Get yourself checked so that you can know that whether I am developing diabetes or blood pressure or I am having abnormal cholesterol. Try to control under supervision of your physician these modifiable risk factor. And the third one, a periodical medical checkup is essential.
Hmm.
Like you take your vehicle for a periodical maintenance, even if it is running okay. So this is also a kind of machinery. You have to check it periodically to know that if something is developing, so you can detect it at an early stage before it started affecting your body, entire body. So periodical medical checkup, especially in young, is very important. Physical activity is very important. because you have to take out at least 45 minutes in your schedule whenever possible. For that, you need not to join a gymnasium or a yoga trainer. No, 45 minutes of even a brisk walk, or do a cycling, or play a two set of badminton, or do a swimming is good enough to maintain your inner milieu of the body. So, rest of the lifestyle you have to modify yourself. You have to keep your sleep adequate. So you have to avoid processed and packaged food as much as possible. You have to consume at least a fresh bowl of green leafy vegetable and salad. Try to include it in your meal. No to tobacco at any stage. And detect your risk factor by a periodical medical checkup and try to rectify them at earliest.
Thank you so much, Dr. Malik. You just gave us a very simple and easy to do task which a person should actually implement in their daily life, but unfortunately, we are not doing. And this is a time, a wake up call for everyone out there to, modify their lifestyle in the view to prevent any kind of heart disease which may occur in future and to avoid this. Lastly, what message would you like to give to our listeners on this World Heart Day about maintaining a heart health and preventive heart failures?
Yeah. So the only thing I would like to tell, especially the younger generation, who have 15, 20 years of working ahead and looking after their family and the society, that you have to look after yourself first. If you ignore your health in the initial years, there are certain things which are irreversible later on. You cannot modify your body at any given point of time as per your wish. So listen to your body, identify your risk factors, control your lifestyle, and if certain medical aspects has been detected, try to control under the supervision of a medical physician as early as possible. Second thing is that heart muscle are unique in the body, that once there is a damage in them, they don't have power of regeneration.
Hmm.
That is why it is very important to know your risk factor so that you can avoid and prevent those injury which later on lead to the heart failure. Heart failure is basically the end stage of any kind of cardiac illness that ultimately lead to the heart failure. So early detection and prevention is very important.
Thank you so much, Dr. Malik, for sharing all your insights and expertise with us because your words, your vision, your experience matters a lot to us and to all our audience to spread this awareness on World Heart Day so that every person, every listeners out there is aware of their heart health and they know how to take care of themselves, their family, and live a healthy, happy life ahead. So thank you so much for coming to our platform and sharing your insights and expertise with us.
Thank you.
Thank you.